If you are really good at fixing chronic pain, it's your duty and your job to charge as much as you possibly can charge in order to help people. And when you can fix chronic pain without surgery or pain medications, you're damn right that you should be getting paid better than surgeons are getting paid. Doctors and therapists, let's talk about your financial rates. How much patients or clients pay you in order to see you for pain relief. If you are really good at fixing chronic pain, it's your duty and your job to charge as much as you possibly can charge in order to help people. First, it tells the market, the chronic pain market, that they can perceive a high level of value by what you charge. If you charge what normal chiropractors, PTs, massage therapists charge, they're gonna put you in that same bucket and they're gonna treat you like a commodity. But when you charge a significant amount of money, usually that means when they pay a significant amount of money, they're gonna get enormous value back. And when you can fix chronic pain without surgery or pain medication, you're damn right that you should be getting paid better than surgeons are getting paid. Coaching a lot of our adhesion release methods providers, the main reason why people don't want to increase their rates is fear. First, they have shame around not thinking that they're worthy of charging a higher rate. But second, they're scared of how the market or people or their older patients would feel about paying a significant more amount of money. We see this all the time with Barefoot Rehab. My rates are quite high, and people will on Instagram, social media will tell me that I'm a crook, I should go to jail, so on and so forth. I should lower my rates, I could be a lot busier. Well, first, I already have a 2 to 4 week wait list right now, so I don't necessarily need more patients. But second, by charging higher rates, it's allowed me to invest in the practice, to start a second business at Adhesion Release Methods, where we teach other pain doctors and therapists how to become non-surgical chronic pain specialists, and it allowed me to now, we have 3 apprentices, so we'll have 4 providers come December 2025 who can treat. We're gonna about to bring on 2 more apprentices. So because I charge higher rates, I'm basically 6xing how the volume of patients in chronic pain that we can treat because of our rates. So I'm reading Seth Godin's This Is Strategy right now, and he's saying in his book, when you're really good at what you do and you offer a lot of value, it's your duty to charge as much as you can charge. It's not that you're not going to try to help people where you can help them, but that cash flow is really important, because investing in your business, investing in your skill set, continuing to develop yourself is how first you give yourself a good quality of life, but also how you can serve more people with more value and help more of the world. If you're just skimming the bottom of the barrel with your rates, be able to have a busy schedule and you're going to be helping people who can't necessarily afford it, but you're going to be stuck 1xing treating your current volume of patients and not being able to go anywhere with that. So I want to urge you, and this coming from somebody who has had a lot of scarcity, shame, and fear issues in the past. I always tell this story. In 2013 or 14 or so, I had a really full schedule, and my office manager, Leanne, came to me and said, "Chris, we can't pay rent." And I was like, "How is this possible? We have a full patient schedule." And she's like, "Half of the people on your schedule are free. They're not paying anything." And that hurt a lot, because I was starting to date my girlfriend and we were about to buy a house. And I was like, this is a really big problem. So I learned this lesson the hard way. And now I realize that the higher my rates that I charge, the more I'm going to be invested in delivering value for the rates that I get. And the more I'm going to be able to continue to invest in my skill set so that I can go and train at least 6 times a year in St. Louis with my mentors at Precision Health Group. I can do other things to develop my mindset and my body. I can take care of my own body, and I can continue to invest in Barefoot Rehab and Adhesion Release Methods. We currently have 50 Adhesion Release Methods providers across the world, but we need 100, we need 500, we need 1,000. And that only happens when I'm able to continue to invest in things that allow me to do better. So please, I beg of you, if you are a really good pain doctor or therapist who's offering non-surgical chronic pain relief, you need to be charging as much as you possibly can charge. If you need help with this, this is one of the main things that I coach with providers one-to-one in order to help them reach their financial goals and ultimately deliver better care to the people who really need their results. Because guess what? People in chronic pain who have already been to 5, 10 other doctors or therapists, they've already spent way more money in treatments that aren't going to give them the sustained relief that they want and they need. When you learn how to diagnose, find, and treat adhesions, you have a skill set that's going to offer enormous value to the chronic pain market. But that only comes when you're able to increase your rates. So please get over your shame. You are worthy. You deserve love. And get over your fear. The best way to face your fear is to see the dragon in front of you and to go after it head on instead of retreating behind the dragon. In this way, you can and create a really amazing life for yourself and all of the people who are lucky to find you. Please increase your rates.